VERSALAB LE. Connect the power cable at the back side of the machine and the other end to the main socket. Connect one end of the coiled cable to the machine and the other end to the 8 MHz probe. Press both the ends to get a locked sound and mount it on the probe's holder. Please note, the 8 MHz probe is an important component of the VERSALAB, and the sensor inside the probe is made of quartz dust. Care should be taken while using this probe. Do not drop it on the floor and it may damage the probe. Connect the PPG at the appropriate socket. While connecting, take care of the polarity of the probe. Connect the foot switch to the appropriate socket. This foot switch is used to transfer the data from the VERSALAB to the computer and for VERSALAB DX. Additionally used to run the thermal paper from the built-in printer. Connect one end of the interface cable, 9-pin D-male, at the back side of the machine and connect the other end to the PC. Please take care of the male and female part of the 9-pin D connector. Improper connection may damage the connector. Software installation. Place the software CD in the CD drive and open the CD drive. Then you will get the following screen. You may see Setup and Utility Files screen in the CD content. Sometimes the operating system Windows XP installed in your computer may not have some of the support files to run our software. You get some runtime error message when you run the software. Whenever you get these messages, you may uninstall the VERSALAB software from the PC and install the utility files in the utility folder. You may refer the utility installation procedure given in the troubleshooting section elsewhere. Open the setup folder and you may see the following screen. Install the software by using setup.exe file. The installation is automatic and select Next in all the screens that appear until you are asked to select Finish. Keep selecting the Next menu and finally select the Finish menu to complete the installation. On completion, an icon VERSALAB is created on the desktop. Functions of important menus. The following screen is the default basic screen with control menus in the PC software. There are 3 important menus: Patients, Records, and Settings, and we shall study them one after the other. Settings. This control menu has got 7 sub-menus as listed below. They are Port Setting, Logo Setting, Modes, Instruction, Reference, Consultants, and Header Settings. Port Settings. The VERSALAB unit is connected to the computer for transferring the data through the communication port of the computer. The older systems have more than one serial port and the newer one will have only one port. To connect the correct port number in the system, this port setting is used. Before selecting the correct port number, you may have to check the port number from your device manager and then select the same number in this menu for communication. If alternate number is selected, you may get an error, communication failure, in the software indicating the port number as not matched correctly. This is an important menu for operating the software. Logo settings. Normally, every hospital or clinic will have their own logos and they are printed in all their printout. As this software also gives a patient report, we are allowing the user to insert their logo in the report. Please note, the image will have a prescribed location and it cannot be modified. For every user, the location is the same. You may use any BMP or JPEG image of 256 KB size. Bigger size image may disturb the rest of the setting. Instruction. This menu is used to switch on or off the instruction whenever we select a menu. This is an useful tool for the beginners, and once operator is trained on the software, they can switch off the instruction menu. By default, it is switch on. The user will get a message box after every operation when it is on. Reference. This menu is used to add the list of referral doctors' names in the system, and this is useful when we enter the patient information data. Consultant. This consultant menu under settings is used to add the list of consultants and their specialty. When selected, the name and specialization of the consultant will appear on the patient report. Use Add menu and then the name and specialization are entered. After entering, use Update menu. This header menu under Settings menu is used to record the header details of the hospital. The logo setting is already done. This completes the one-time setting of the software and it is ready for use. Operating the software. Patients. Whenever a new patient comes for a test, you should start from New menu. And if an old patient already tested comes for a review test, then you may use Old Patient menu. Under the Patients heading, there are New, Old Patients, Edit Records, Delete Patients submenus are present. We shall now discuss about them. New. When the New menu is selected, then the following screen will appear. You have to enter the patient ID, patient name, sex, age, consultant name, specialization, and referral doctor name. If you need patient's address, it can be added. Once all are entered, the software is ready for the patient testing. Tie the BP cuff to the upper arm. Apply jelly on the application area. Keep the probe on the skin and locate the brachial artery. You will hear the pulsatile audio of the blood flow. Do not press the probe into the skin. It may obstruct the blood flow. Always keep the probe toward the blood flow at an angle of 45. Slightly adjust the angle of the probe to get the maximum clear multiphasic sound. Hold the probe at that position without pressing the patient's body. You will be seeing the Doppler waveform on the LCD screen and also on the computer screen. A good multiphasic waveform may be recorded on the system using the foot switch or hand switch. Press once to record the waveform. Do not press and hold the switch. Inflate the cuff using the rubber BP bulb until the sound is blocked. Slowly deflate the cuff until you hear the first appearance of the sound. Note the BP value at that time, and it is the systolic BP of that location. Tie the BP cuff at ankle. Brachial and ankle cuff size are the same. For thigh, use the bigger BP cuff. Locate the posterior tibial artery as done at brachial artery. Always the operator should rest the hand on the couch or patient body for steady and stable Doppler waveform. Inflate the cuff until the Doppler pulsatile multiphasic sound stops. Slowly deflate the cuff and note the BP dial meter reading at the first reappearance of the sound. Note down the BP dial reading. During the inflation and deflation process, the probe should be held steadily. Locate the dorsalis pedis artery as done at brachial and posterior tibial arteries. Always the operator should rest the hand on the couch or on patient body for steady and stable Doppler waveform. Inflate the cuff until the Doppler pulsatile multiphasic sound stops. Slowly deflate the cuff until you hear the first appearance of the sound. Note down the BP dial reading. During the inflation and deflation process, the probe should be held steadily. Tie the toe cuff around the toe at the root of the toe gently. Fixing the cuff tightly will obstruct the vessel and the waveform height may be reduced. Tie the PPG gently at the tip of the toe. PPG glass should face the skin side, not on the nail side. Do not use jelly for the PPG. If the size of the toe is smaller and does not fit both cuff and sensor, try to refix the cuff, fixing it as down as possible. Slowly inflate the cuff till the waveform becomes a straight line. Slowly deflate the cuff and note the BP at the first appearance of the waveform. Wait for about 5 seconds and allow the waveform to stabilize. Record the waveform by using hand switch or foot switch. Repeat the procedure for the other foot. This completes the capturing of Doppler and PPG waveforms and the measurement of systolic BP. The process is clearly indicated in the video we have just seen. The BP values have to be entered for the calculation of ABI and TBI in the respective BP boxes as shown below. Preview. Now the test is completed and the patient report may be printed. Use the preview menu and this leads to this page where the Doppler waveform, PPG, toe waveform, BP values, ABI, TBI and the interpretations are generated and displayed, the entire data can be stored using Save menu before printing. Use the Print menu to print this page on paper. Old patients. This menu is used for the screening of the test when they come for the subsequent visit. Once you select the old patient, it will ask to select the patient name, followed by their ID. The procedure for selecting the Doppler and PPG are the same as new patient's procedure. At the end of this test, the patient records are printed and saved. Edit records. This menu is used for modifying the patient information already saved. Select this menu. It will ask for patient name, then ID, and then visit date before modifying the value. Delete record. This menu is used to delete the details of the test already taken and saved. Select this menu. Then it will ask to select the patient name, ID, and then the visit date. Review records. This menu is used to review the test data from the already stored information. When selected, you may be asked to select by using patient name. After selecting the patient name, it will ask for ID and the visit date. Once all are selected, then all the patient information and the Doppler data are ready for review. Select Preview for viewing them. If you need to print them, select the Print command.